Half of the state of Oregon is now in the lower risk category, and that's after some counties met the COVID vaccination rate of 65% and submitted a vaccine equity plan to the state. Now, Multnomah and Baker counties make that jump from high risk to lower risk. Curry, Grant, and Tillamook counties will move from moderate to lower risk. 15 counties will remain in high risk, shown in the orange there on your screen. And the 3 yellow counties are in moderate risk.
Well, those counties in lower risk can now allow restaurants, gyms, and movie theaters to increase to 50% capacity. Outdoor venues like zoos or gardens can also allow up to 50%, and retail stores and shopping malls can open up to 75% capacity. These rules now apply to businesses in Multnomah County.
But just because the county is in lower risk now does not mean it's fully reopened. Health officials still are encouraging everyone to wear masks indoors. Joining us live now is Jessica Guernsey, Public Health Director for Multnomah County. Good morning. Good to see you again.
Good morning. Thanks for having me.
Yeah, so what does this mean for the residents of Multnomah County with this move to lower risk?
Well, as you said, this puts us beginning today into a category where you see higher capacity allowed for things like eating establishments, drinking establishments, gyms, retail spaces, outdoor gatherings, and even looking at growing your social bubble, so to speak.
Now, we've hit that 65% vaccination threshold. That was, one of the requirements to move into lower risk. But just because we've made it to 65%, that doesn't necessarily mean we can all let our guard down, right? That's not the herd immunity that we would want to see.
Correct. The 65% is not a measure of herd immunity. It's a measure simply of a threshold that the governor and the state have landed on to move us into a lower risk category where it's not associated with the disease spread in the community. So one of the things folks need to remember, and we did put out a public health advisory related to continued mask use, regardless of vaccination status when you are indoors, because we are continuing to see disease spread. It is trending downwards, which is a good sign, and our hospitalizations have somewhat stabilized. So all of those are good signs, but we're not out of the woods yet. So we really want people to continue to use precautions. We're just not out of the woods yet. We have a lot of folks that aren't vaccinated, that are vulnerable, and we want to make sure that we get to them in the summer months so that hopefully we have a more stable fall and don't have a fall wave.
Okay. I mean, what are the issues when it comes to getting to those folks and getting them vaccinated? It seems like the vaccinations have been widely available from what we've been reporting.
Well, I think they've been widely available for some people. So that's really what our equity plan is about. We knew from the get-go that there were barriers for folks for some of the large throughput vaccination sites. And in Multnomah County, we received a very small amount of vaccine as compared to the large healthcare systems and hospitals. And we really tried to concentrate our efforts to reach people who were expressing that they were encountering barriers to get vaccinated, things like the technology divide, language access, and also things like people not seeing folks that look like them at a vaccination site, or just needing to get the message from multiple people that they trust in the community. So that could be faith leaders, community leaders, elected officials, peers. Not everybody has the same on-ramp, if you will, to decision making. But we know that there were some really practical reasons that people could not get access to vaccines. And that's what's outlined in our equity plan about how we're going to continue to work with community to make sure people have access.
So we've seen a lot of mixed emotion and some frustration from certain business owners in Oregon about Governor Kate Brown's way that they've gone about the masking here and the verification for a vaccination status if you wanted to unmask. It's different than the way other states have done it. I'm curious, what has the reaction been here in Multnomah County? What are your thoughts on the way we're approaching the mask wearing?
We've been spending the week doing forums with business leaders. We're doing one today again. And, really what we've heard is that the idea that business owners are going to validate whether someone's vaccinated or not is very cumbersome and difficult. And that is one of the reasons that we met with community and talked about continuing the public health advisory around continued mask use. So you will see signs up in businesses that we've helped produce that really emphasize that public health advisory of continued mask use, because you don't know who's vaccinated, who's not. It's very hard to tell. And if someone has just had one dose of vaccine, which is the threshold for the state for the 65%, they still need to get a second dose. And then they have to wait 2 weeks after that for, the full coverage of the vaccine. So there's a lot of folks that are in a flux state. And for now, we are just asking people to, when they are indoors, continue to mask.
All right, Jessica Guernsey, some good information as always. Thanks for joining us this morning.
Thank you.
Well, the new guidelines for lower risk also allow more people at event centers like the Moda Center.
Yeah.